Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Welcome to Healing Through Dentistry. This is a solo episode. Eva is speaking, and I would be speaking about another nice health transformation because we have very good feedback from all of you who are saying, please share more stories. So today it's on a go. I'm in the park close to where I work in Brno in the Czech Republic. It's winter time. We had a little snow. And I'm here with my dogs, Husky and Goldie. So they're the first listeners. So let's begin with the story. So I have in mind my client who I have finished some work a week ago. And I would like to share a little bit of her bigger story. So she's coming to our clinic looking for a dentist because she hasn't been for some time. And she's looking for a holistic dentist, somebody who would connect the dots together. So we are taking it, with a start and then we create a roadmap. In her case, we had to restore a few cavities. And I would just touch on that because lots of people, they would think that everything is okay and it looks okay. However, the X-ray, the dental X-rays or 3D X-ray, they reveal a bit more. So in this case, there were cavities underneath the composite fillings, underneath the white fillings. I would say in old days, there was a bit bigger shrinkage in this material, so we tend to see cavities underneath. So that's why we try to use ozone before we place a new filling. We use zirconia material. So we have done that part, which I think it's the most important because you would like to protect all the teeth, healthy teeth, and remain them the same condition, meaning vital. Because if you would be focusing on placing implants, which is another part of her story, then you would postpone the cavities or you would leave them, and these teeth, they would get to the stage that they would be inflamed and you would have to do the implant, which is not necessary. So we have done these few fillings, and the next step for her was she had actually 5 root canal treated teeth, but there's one which is causing her pain, and she would like to deal with that, which is on her lower right hand side. It's premolar, second premolar. It's number 45, and this is the signing in Europe. These teeth, they tend to create, symptom signs, which is like kind of if you ask clients if there is anything they experience in terms of whether they have a back pain or a knee pain or a digestion problem, they would usually tell you that yes. And this is actually the stomach meridian, which that I have just described. You could have these symptoms, or, this meridian also is upper first and second molar. So that could have similar symptoms. But this client, she had a periapical lesion around the tooth, which means that there was visible inflammation, which was surrounding the tip or the root, the apex of the root. What is important to say that many dentists won't realize that, if you see the apical lesion, which is clear and the client can see it, you can point it, you can show it to client. This is one of the things. So this is where we have inflammation, which is surrounded, and there is infiltration liquid, which is like kind of destroying the bone around. So that's one thing. But the second thing, which many of other dentists don't realize, is that when you have sclerotic bone around the tooth, which is like all the dentists would tell you, this is good, you have a good root treatment, I would not do anything, the tooth is fine, you should be fine, you're fine. But we see that the sclerotic bone, which is like a hyperdensity, like, growth of the bone around the tooth, is because it's the immunity, or the body is so smart, and the body would like to protect us. So it builds more tissue around the tooth, which is necrotic, which is dead. So there's no vitality there. There's no capillaries, there's no veins, there's no arteries, which are bringing the oxygen and the life into that area. So this is also the issue, which the same symptoms would be created as if you would see it clearly on the x-ray. So this client, she is worried about this tooth because it is sensitive. It's usually sensitive when there is a lesion, but not always. Other clients, they would have this condition for 15 years, and it will be, it would be sensitive, and it will be on and off with the symptoms or signs of discomfort. Some people, they would not even notice that, that they would take it as a normal condition. So we have decided that we would place a zirconia implant, and if it would be possible, we'll do it immediately. And that's what happened. And 4 months later, I have seen a client for a crown preparation and fit, and she said how much she was so surprised how much energy she gained, and I would say it's 2 levels. I would say it's one, that the clients, all our clients, they have to get ready for the procedure, which means that you are gluten-free, sugar-free, alcohol-free, nicotine-free, seed oil-free, and dairy products-free for strictly a month before and month after the surgery. And secondly, you're adding a bag of nutrition and nutrients and micronutrients within your diet, which is supplementation. So I find this very important. So the body has a building stones to rebuild and strengthen, which is beautiful. The second level is vegetative nerve system, which is like automatic response of the body, or how the body function, which is, I always explain to my clients, it's the way that you are in a stress response if you have chronic inflammation in your body, and you don't even know that. So the body is like in fight and flight regime, and once you remove the inflammation, the clients, they usually, even on the dental chair, they would say, oh, there's like something went out, or they would describe just something left me, the energy went through me, or they would say, okay, I had like something in my lower back was going away. So you can clearly, the body feels when the infection goes away, and then the nerve system could rebalance, and it does, because we see clients coming back after a few months, because we're doing these crowns, so they have to come back. So after 4 months, they come back, and they are usually different people. So this client, she's saying how much energy she gained. Some other clients, they would come and they're really relaxed, and I always ask what changed in their life. They say it's really the removing either of root canal treatment or the implant, titanium implant. This tooth is connected with digestion. It's a stomach meridian. It's connected with anterior side of the knee. So, that could be signs of which you could perceive. And lots of people, they are. So, yeah, it's fascinating for our clients to just find out that, the knee doesn't hurt anymore. So that's what they didn't really plan, or they might not think that would happen until it happens. One more thing I would like to talk about with this story is that this client, she's in her mid-40s, I would say, and she said that when she was 14, she had had cosmetic treatment done on her front teeth, and so all 4 front teeth, they have crowns. But what they did these 30 years ago, they were devitalizing the teeth, so they did root canal treatment on each of them, just for the reason of that it won't cause any troubles in future, which is so wrong. So like, we have lots of these treatments happened in past, but these days dentistry also is performing these cosmetic kind of procedures, in terms of when you are in close relation of the pulp chamber and you need to prepare the tooth for a different angle. sometimes we are very, very close. So they devitalize the teeth and they create or perform the root canal treatment. She has had this for past almost, 30 years, and she's just considering to replace them with zirconium implants later on. So we will see if she decides for that, because I have to say that I always like to stress the intuition of the client, and they would say, okay, I am ready to do the lower right hand side area, or I'm ready to do everything. It's just, I think it just depends on what's the initial story of the client, whether there is a client who comes and really deals with the chronic issues or illnesses or discomfort, or whether the immunity is securing them well and they don't really perceive any problems. So I would like to also add one more thing from the perspective of symbolism, because we have started to really read also the symbolism of the teeth when we do the surgery of the teeth we are removing or we're dealing with, because it's another perspective and another healing modality which we can kind of add to it, because this is not only physical, it's emotions, it's stored emotions. It's so detailed up there that we would not foresee it. So I have experienced that if we do, 4 implants, so 3 are very good and they're strong, and then one of them is a bit weaker, we read the symbolism, and usually the client would be like, okay, this is what I'm dealing with. So we would recommend to also other practitioners, which is like shiatsu or craniosacral therapy, which are rebalancing the vegetative nerve system, which is like the automatic nerve system which we're not controlling, and this is how people heal and thrive. Or we could use the help of traditional Chinese medicine, acupuncture, which is balancing the meridian system as well. So as I recommended today, we had 2 clients who had 1 implant done today, and they both are lying on a meridian of lung meridian. And then they said even their practitioners, they always say that it's a bit weaker. So lots of you guys who are listening, you have your own practitioners, homeopathy or craniosacral or other modalities, energy healers. We're finding that is a great combination in healing. So I recommend to others to try that too. Thank you for listening to Healing Through Dentistry, and I would be happy to bring another story next time. Take care.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.